So the purpose of this presentation is first to increase knowledge regarding COVID-19 and vaccines. Second, to identify barriers to getting vaccinated and reasons for vaccine hesitancy. And third, to recognize culturally and linguistically contextual strategies and resources to support vaccine uptake. So the first section, Vaccine 101. Now that we've seen the objectives and larger picture, let's begin with an overview of vaccinations. So why do we use vaccines? Vaccines keep you from getting diseases such as flu, chickenpox, and now COVID-19, for example. The world uses vaccines because they work really well to prevent diseases. And vaccines have helped eliminate worry about getting many diseases in the United States. So vaccines also train the immune system to fight the germ that causes the illness. A person does not have to get the disease first to build up defenses to fight against a disease. Without getting vaccinated, a person would need to get the disease to have any form of immunity. In some cases, immunity does not last forever, whether you get a vaccine or get the disease. Now, one way to help keep people healthy is widespread vaccination. So vaccinating a community can help stop diseases like COVID-19 from spreading from one person to another and making everyone sick. This is called herd immunity, and when most people in a population or group are immune to the disease. And when a lot of people cannot get the disease, like in herd immunity, it helps keep you, your family, and your community safe and healthy, especially those who are not immune and can get the disease. So what are the COVID-19 vaccines? Here's a short summary of the COVID-19 vaccines currently available in this country. There are 3 products that the Food and Drug Administration, or FDA, has authorized for use: the Pfizer vaccine, Moderna vaccine, and Johnson & Johnson vaccine, also called J&J or Janssen, as we see along the top here. There's one product that is now fully licensed by the FDA. That is the Pfizer product. So let's take a look at the table. The first row here, who can receive this vaccine? For Pfizer, people 5 years and older. The Pfizer vaccine for 5 to 11-year-olds is a smaller dose and packaged differently. For Moderna and Johnson & Johnson vaccines, people 18 years and older. So the dosage, the next line. Both the Pfizer and Moderna vaccines need 2 doses. The Pfizer vaccine is given 3 weeks apart, and the Moderna vaccine is given 4 weeks apart. The Johnson & Johnson vaccine is just a 1-dose vaccine. Additional dose for moderately to severely weakened immune systems. The next line. Some people who have certain conditions that weaken their immune system need an additional dose of COVID-19 vaccine to help get their protection up to a higher level. This is only for people who got Pfizer or Moderna vaccine for their primary series, 28 days after the second dose. We'll talk more about this later. And separate from that, there are booster shots. Finally, the last line here. And booster shots are now recommended for all vaccines. For Pfizer, it's 5 months later. For everyone 12 years and older. For Moderna, it's 6 months later for everyone 18 years and older. And Johnson & Johnson is 2 months later for everyone 18 years and older. Again, we'll talk more about booster shots later as well. So how do the COVID-19 mRNA vaccines specifically work? So they use messenger RNA, or mRNA, and we call these an mRNA vaccine. The COVID-19 vaccine does not contain any live germs. The mRNA in the vaccine contains information that gives the body instructions to recognize and fight the germ that causes COVID-19. The mRNA tells a person's cells to recreate a certain protein that is part of the COVID-19 virus. The person's body then uses the copy of the protein to start building up defenses. So next time it encounters the real COVID-19 virus, it is prepared to defend the body right away, and there is no delay. The defenses produced are called antibodies, and they protect a person from getting the disease. The mRNA vaccine does not contain a virus, does not create the virus, and cannot cause COVID-19 infection. And they cannot change a person's DNA. So how does the J&J COVID-19 vaccine work? And how is it different from the mRNA vaccines? This is a viral vector vaccine, and it uses a weakened common virus to carry the instructions called DNA, in this case, for the body to tell it how to recognize and fight COVID-19. But the Johnson & Johnson vaccines do not contain any live germs either. Here, the common cold virus has been modified so it cannot give anyone getting the shot the common cold. The body uses the DNA to make a certain part of the COVID-19 virus. The body then uses the copy of the protein to building up defenses, to teach the body to fight against COVID-19 when exposed. The next time it encounters the real COVID-19 virus, it's then prepared to defend the body right away without delay. The defenses produced are called antibodies, and they protect a person from getting the disease. Because only DNA was used and not the live COVID-19 virus, you cannot get COVID-19 from the Johnson & Johnson vaccine either. So ingredients, some other basic ingredients are listed here. Basics include lipids, which make up the fat coating to protect the genetic material or instructions. Sugars, to prevent the solution and fats from bunching up. And buffers, to reduce the irritation of the liquid, or pH, and keep the solution stable. So what's not in the COVID-19 vaccines? Well, the vaccines do not contain fetal cells. No COVID-19 vaccine contains eggs, pork products, gelatin, latex, or preservatives. And the vaccines do not contain DNA and will not alter your DNA. It's very important, especially when we're speaking with the community. So the next section, now that we've covered the basics, let's talk about the safety of COVID-19, vaccine development and efficacy, or how well they work. Here's an overview of the vaccination development process in the COVID-19 clinical studies. Let's take a look. So COVID-19 vaccine program goals. First, the goal is to end the pandemic. And to do so, when public health officials realized that COVID-19 was becoming a global disaster, they gathered with vaccine companies, public health, and vaccine experts to start making a vaccine as quickly as possible. In the US, the goal is to make a vaccine that was safe and that worked as soon as they could, while still following all the safety steps, which we'll go through in a moment. So the clinical studies, who was included? Here we see the Pfizer, Moderna, and Johnson & Johnson COVID-19 vaccine studies across the top. In the first row, we see total numbers of US participants. Then we see the percentages of Black, African American, Asian, American Indian, Alaska Native participants. Then we see the percentages of these age groups across the second to last row. And finally, we see percentages of those with at least one health condition included in these studies. These public health officials wanted to make sure the vaccine worked in all our various populations in the US. So the vaccine manufacturers heard that and tried to include study participants that reflect the diversity of the population, including race, ethnicity, and various ages and health conditions. As we see here, many Latinx, Black, Asian, and American Indian individuals participated in these studies. So vaccination development. You see here, the first COVID-19 vaccines have come out within a year of COVID-19 virus being discovered. And there are many questions about how a vaccine could be created so quickly. So here are the steps used to test, make, and approve any vaccine, including vaccine, clinical studies, vaccine safety review, and vaccine being made, as we see at the top there, to FDA review, to ACIP review, and finally safety monitoring, as well as the original research at the beginning. No steps were skipped for COVID-19 vaccine. Money from the federal government and partnerships helped the process go much faster than usual. The Food and Drug Administration, FDA, made each vaccine manufacturer prove that its COVID-19 vaccine was safe and that it worked, safety and efficacy, just as they would for any other vaccine. This is very important. And future COVID-19 vaccines will also need to go through all of these same steps before they can be approved to be used in the general population. So what we know, a review here. First, we know that the COVID-19 vaccines work at protecting people from getting any COVID-19 symptoms most of the time, 60 to 80% of the time. That is great news. Second, because we learned it worked in all those people of different ages, different racial and ethnic groups, and in people with health conditions who participate in the vaccine studies, we know that the vaccine works equally well in everyone. Also, the vaccines are very good at protecting against severe disease, going to the hospital or dying, which means people are less likely to go to the hospital and less likely to die. The vaccines work even against the Delta variant. It boosts protection in people who already had COVID-19, so the vaccine protects against another infection. And COVID-19 vaccines also help decrease the amount of COVID-19 disease spreading in our communities. So what are the variants? COVID-19 is a virus, and it mutates or changes over time. There have been several variants of concern, especially the Delta variant, and now the Omicron variant. The vaccine protects us from severe disease, hospitalization, and death, as we discussed. It even protects against the variants, especially with the booster dose. It's also very important these days. So in summary, the truth about COVID-19 vaccines. Here are some reminders. The top, mRNA vaccines can only deliver instructions. They cannot do anything else. The only thing that is tracked is a record of your vaccination. Pregnant people that have been vaccinated have healthy babies. People who wanted to get pregnant have done so after getting the COVID-19 vaccine. And there is no virus in the vaccine. A person gets COVID-19 when exposed to a person who is infected with COVID-19. Again, this is very important and very helpful to have these facts in hand when we speak with the community. So next, third section of this talk, getting vaccinated. Let's talk about what to expect when someone gets vaccinated. So what to expect? Vaccine is recommended for everyone 5 years and older, even if someone already had COVID-19. As of November 2021, the Pfizer vaccine is the only vaccine approved for people 5 years and older, and all other vaccines for 18 years and older. Like I mentioned before, 2 doses or shots are needed for the COVID-19 vaccines from Pfizer and Moderna. The time between the doses depends on the vaccine someone is getting. The Pfizer vaccine must be given 21 days or 3 weeks apart, and the Moderna vaccine must be given 28 days, 4 weeks apart, as we discussed. It is very important that someone gets both vaccine doses, the same product for each dose, and that the doses are given at the correct time apart. The Pfizer and Moderna vaccines are only fully effective with both doses of vaccine. And we recommend that someone schedules their second dose appointment when they get their first dose, if possible. So only 1 dose is needed for the Johnson & Johnson vaccine, as we discussed. And protection happens about 2 weeks after the final dose. At the clinic, you should be given a fact sheet called the Emergency Use Authorization, or EUA fact sheet, from the federal government. You might be asked to sign a form saying that you read the fact sheet or had it explained to you. The person giving you the vaccination will ask if you have any allergies or if you have had any reactions to vaccines before. So free vaccines for everyone. COVID-19 vaccine will be provided free of charge for everyone. A person might be asked for their insurance information because healthcare providers can charge an administration fee to insurance for giving the vaccine to someone. However, no one can be denied a vaccine if they are unable to pay. And anyone can still get the COVID-19 vaccine if they do not have insurance and/or cannot pay the administration fee. No one should receive a bill for the vaccine or administration fee. And if you get a bill, call your clinic and let them know you should not have to pay. This is very important. And most importantly, anyone can be vaccinated regardless of immigration status. The vaccine will be available to all. No one will be asked about their immigration or citizenship status. Again, very important to remember when speaking with our RIM communities. So after vaccination, some common side effects. Let's talk about what happens after someone gets their shot. Some side effects are common after vaccination. For example, where the shot was given after getting the COVID-19 vaccine, the person will likely have a sore arm or develop some redness or swelling, and sometimes around the underarm or armpit. General symptoms include muscle aches, headache, tiredness, or maybe a fever and chills. Now, these side effects usually last 1 or 2 days. If your symptoms don't go away or get worse, you may have COVID-19. Get tested if you think you may have COVID-19. After vaccination, common side effects. Remember, common side effects are normal. They mean the vaccine is working. Side effects usually start within a day after vaccination and go away in 1 to 2 days. And side effects may not be as intense among elderly people and younger children. Also some helpful facts to know. So treatment of common side effects. Side effects can still be pretty uncomfortable. So you can use over-the-counter pain relievers that you usually take for pain or fever, such as acetaminophen or Tylenol, or ibuprofen. You can use cool clothes to relieve the swelling or pain at the injection site. You can keep moving your arm. And it is not recommended to take pain relievers like acetaminophen or ibuprofen before you get vaccinated, or if you do not have side effects after, unless you take them for something else like routine pain management. So very rare serious adverse events. A serious adverse event is something that is life-threatening. If someone has a severe reaction after they leave the place where they got the vaccine, they should contact their healthcare provider, call 911, or go to the nearest hospital. So the first one here is blood clotting issues. Let's take a look. There is a risk of rare but serious condition involving blood clots and low platelets in people after receiving the Johnson & Johnson COVID-19 vaccine. This risk is very low. Most people who developed this blood clotting issue were adult women younger than 50 years old. For women 50 years and older, and men of all ages, this adverse event is even more rare. This condition is treatable. For 3 weeks after receiving the Johnson & Johnson COVID-19 vaccine, contact your healthcare provider or go to a hospital or clinic if you notice any of these symptoms. Shortness of breath, chest pain, leg swelling, abdominal, stomach pain that doesn't go away, severe headaches or headaches that won't go away, blurred vision, easy bruising or tiny blood spots under the skin beyond the site of the injection. And how rare is this? Overall, 5 per 1 million doses administered, but the rate is highest among females, 30 to 39 years at 10 per 1 million doses. Next, we see anaphylaxis. Some people also have severe allergic reactions to the COVID-19 vaccine. It's very rare, but serious. Public health officials are aware of this and have talked to vaccinators and clinics about it. Clinics are prepared to respond quickly with the right medication. The person getting the COVID-19 vaccine will be asked to wait 15 to 30 minutes after they have been vaccinated so that clinic staff can observe them. This will likely be in a place that allows for social distancing. And how rare is anaphylaxis? 2 to 5 cases per million doses. Next, we see inflammation around the heart, known as myopericarditis. Some people who have received the Pfizer or Moderna mRNA vaccines have had rare cases of myopericarditis or inflammation around the heart. In most cases, symptoms begin a few days after the second dose of the COVID-19 vaccine and went away quickly. Most cases have been in young men. The chance of having this occur is also very low. Seek medical attention right away if you have any of the following symptoms after receiving COVID-19 vaccine: chest pain, shortness of breath, or feelings of having a fast beating, fluttering, or pounding heart. And how rare is myopericarditis? Overall, 10 per million doses, 10 per 1 million doses, but the rate is highest among males 16 to 17 years at 69 per 1 million doses. Finally, there's nervous system weakness. known as Guillain-Barré syndrome in this case. A few people who have received the Johnson & Johnson COVID-19 vaccine have experienced Guillain-Barré syndrome, GBS. GBS is a rare disorder where the body's immune system damages nerve cells, causing muscle weakness and sometimes paralysis. Most people fully recover from GBS, but some have permanent nerve damage. The benefits of vaccination outweigh the slight risk of this side effect, and the chance of having this occur is, again, very rare. Seek medical attention right away if you've had any of the following symptoms after receiving the Johnson & Johnson vaccine. Weakness or tingling sensations, especially in the legs or arms, that's worsening and spreading to other parts of the body. Hard time walking, hard time with moving your face, including speaking, chewing, or swallowing, double vision or not being able to move your eyes, and difficulty with bladder control or bowel function. And how rare is Guillain-Barré in this case? Overall, it's 6.2 cases per million doses, with the rate highest among 50 to 64 years of males. So moving on, Moderna and Pfizer. CDC recommends using Moderna or Pfizer when there is a choice of vaccines. Now let's talk about immunocompromising conditions, those living with certain immunocompromising conditions. CDC now recommends that people with certain immunocompromising conditions that receive the mRNA vaccine, Pfizer or Moderna, should get an additional dose as part of their primary series. This is different from a booster dose. Because of a weakened immune system due to illness or its treatment, we have clear data to show that people who are moderately to severely immunocompromised may not have responded to the two-dose series of the Pfizer or Moderna vaccine. So an extra dose in the primary series is recommended, 3 doses in the primary series. While an additional dose may improve protection, these people should also continue to take other precautions, including masks, distancing, washing hands, etc. There's currently not enough data to recommend that people who receive the Johnson & Johnson vaccine should receive an additional dose at this time. People should talk to their healthcare provider about their medical condition and whether getting an additional dose is appropriate for them. So fertility in pregnant women, also a very important topic many people ask about. There is no evidence the vaccine causes fertility problems. Pregnant women should get vaccinated. And if sick with COVID-19, there's a higher risk of poor outcomes for themselves and their babies, such as stillbirths and preterm birth. There are no reports of increase in pregnancy loss, growth problems, or birth defects in vaccinated women. And now booster shots. Very, very important these days. Many routine vaccines require booster shots to maintain protection. For example, people are due to get a tetanus shot every 10 years, and that is a booster shot. These boost your ability to fight the disease if you're exposed, because we know original protection from the vaccine decreases over time. So people who have received their initial COVID-19 vaccine series, 2 doses of Pfizer or Moderna vaccine or 1 dose of Johnson & Johnson vaccine, still have some protection, even once protection starts to decrease. The booster shot helps get protection back up to a higher level. And as we learn more about COVID-19, and as we continue to track how the vaccines are working, we will continue to follow the science and update recommendations that will best protect people from the disease. So getting a booster shot. People 12 years and older should get a booster shot. Pfizer is the one here for 12 years and up. Get a booster shot at least 5 months after the second dose. For Moderna, 18 years and up will get a Moderna booster shot 6 months after the second dose. And Johnson & Johnson, 18 years and up, will get a booster shot at least 2 months after the initial dose. Boosters are especially important if they're 50 years of age or older, live in a long-term care facility, have certain underlying medical conditions. And finally, the booster can be any of the COVID-19 vaccines. Officials also authorized mixing and matching COVID-19 vaccine boosters, meaning anybody who is eligible to get a booster shot can get any of the 3 currently authorized or approved vaccines, Pfizer, Moderna, or Johnson & Johnson, regardless of what dose they received for their primary series. Talk to your healthcare provider about your risk, the need for a booster dose, and any questions about mixing and matching doses. So COVID-19 vaccine for children, 5 to 11 years. This time, the Pfizer COVID-19 vaccine is the only one that has been studied and authorized for use by people ages 5 years and older. Moderna and Johnson & Johnson are not yet available. Children ages 5 to 11 should get the Pfizer vaccine for 5 to 11-year-olds, as it's a smaller dose of vaccine than the Pfizer vaccine for people 12 and up. Data from Pfizer studies show that the vaccine is safe and effective for children. Children have similar side effects after the vaccine like those that happen after the other vaccinations. For some immunocompromised children aged 5 to 11 years old, CDC now recommends an additional dose of the Pfizer vaccine to complete the primary series. So again, 3 doses in this primary series in this case. Check to make sure the vaccination location you're going to has a vaccine that matches your child's age. Remember, it's a different box, for example, and a different smaller dose. So finally, other important ways to protect ourselves. Remember, it is important that we continue to follow public health recommendations. Vaccines are just one piece of everything, and that we wear a mask, that we wash our hands often, we socially distance when possible, we avoid crowded space, and remember that outdoor settings are generally safer than indoor spaces, as ventilation is very important.